So what are you guys doing to work to bring more patients, I guess, or more providers to the area for the patients that we have here? Like as UnityPoint Health wide, what kind of things are you guys doing to bring more providers here, like yourself, whether it's bringing people back or bringing new providers to the area for patients?
Well, before I answer this question, I think I have to mention a couple of points. Number one, the whole healthcare system for last 1.5 years, they were kind of a stretch and they were tired. Mm-hmm. The whole healthcare community, they get many punches from the COVID situation. At the same time, we had few doctors in this area retired. Yeah. And they had some difficulties to bring. And now I believe the situation is much better. The vaccine is here, and fortunately, high percentage of the community vaccinated, high percentage of the population in the country vaccinated. Yeah. And we don't have that much stretch in the healthcare community, and I heard good news, and we have few providers like myself. Mm-hmm. We came back to community, and they have new hires and new physicians for the North Pole, and also for the near future we have new providers even in Muscatine in internal medicine department, family medicine. It's a good news that we have this opportunity right now. We can absorb all of the patients, they need primary care, and we have good news for them that they can stay in town and have their own primary provider. Yeah. Who are some of the newest providers in town that people might not be or might not know are here yet, that if they're looking for a new provider or primary care, like you said, a primary care provider, who are some of those new ones that are accepting new patients right now? I think Dr. Dodds is starting in North Pole, and another physician I heard, Dr. Hostetler, is retiring next few months, unfortunately. And we have somebody replacing and already is coming. We have very good news. After, I think, 1 year, Dr. Ismail was successful to come back to Muscatine and is going to start seeing his own patient next month. And we have opening here. Right now, we have this capability to absorb whoever needs primary care and whoever needs to establish in town in Muscatine. Yeah. That's good. I know there are so many people out there that don't have primary care providers for whatever reason, and it's so important. And I believe that now more than ever after my health scares in the last few years, just knowing like it's important that you have that person who knows your medical history and who you see on a regular basis and can see some of those things. You know, when you have changes in your health, they can be right there with you and see those changes happening. It's so important to have someone checking in, even if you don't have anything wrong, to have that like yearly or 6-month checkup with somebody on a regular basis. So it's important, very important, to establish care with a provider and have someone that you're going to for those checkups, even if you're not feeling ill, just for those checkups every year. I think medical science is changing. Many years ago, when we had that patients, we haven't had that much subspecialist. Yep. And the primary doctors was the only one basically taking care of the patients. Right now with this modern medicine, and that's a good thing, is that we have all other resources. And this way, I think medical primary care, the rule is much, much more important, because if we don't have that primary care, for example, somebody has some cardiac issues and going to see his heart doctor, and they say, hey, you don't need to have too much salt and you don't need to have too much water. Yep. And because you have congestive heart failure. The same patient's going to see a kidney doctor because have kidney issues. Yep. And that kidney specialist say, hey, you have to push more fluid. Yeah. This basically inconsistency between different subspecialists, bringing the necessity of one medical primary care putting all of those puzzles together and bringing all subspecialists together and giving that clear, bold, and simple information to the patients to enhance and optimizing that care. And I think in this situation, the role of primary care is much, much more important, and bringing everything in one white page and make that simple guide to the patients and optimizing patients' care.
Yeah, for sure. So if people don't have a primary care provider, what's the best way for them to get established with one right now through UnityPoint Health?
Yeah, actually, they gave me one number. There is one central number for the central scheduling. That number is 309-779-7979. This is a central scheduling. Whoever needs primary care in any field, in the family medicine, internal medicine, OBGYN, pediatrician, they can call this number, and based on that availability, this central scheduling basically guiding you. And internal medicine, Dr. Ismail is coming, and we have still active opening practices, and the phone number for internal medicine is 563-262-4111. They can call and they can establish care.
Awesome.
Anytime.
So it's as easy as calling, and you can get started.
Yes.
So important. If you don't have a primary care, or maybe your primary care is leaving, you can just give them a call and get established with someone new, so that you don't miss out on that monthly or yearly checkup, whatever it is that you're needing. There's plenty of new providers, new faces that can take over that service, even if your provider is retiring at this time. My Hostetler's been my provider for so many years. It's so sad to see her go, but it is a big loss. But I'm so happy for her. It's like we're sad for us, but happy for her. But lots of great providers coming in to kind of help take over that. She has a lot of patients.
Yes.
So, but it's great to see that they're filling those gaps so that people won't go without care, for sure. So another question that we had was about the investments that UnityPoint Health Trinity Muscatine is making in our community. As a whole, it's so important for us that our primary care, our primary healthcare facility in Muscatine is making good investments in the community as well. Do you know of any investments, or what investments they're making in the community here to continue growth and to continue to be able to, be the primary healthcare facility here in Muscatine?
Yes, before I answer that question, I just wanted directly to the listener, whoever basically listening to this, I wanted to mention one thing. I personally believe medicine history is dividing before COVID and after COVID. After COVID, I believe everybody learned, and they realized how important we have solid, strong community medical care in the community.
Yeah.
And I think if whoever has minimal doubt, they can go to different places out of the community. They realize after COVID, we need to have solid, strong healthcare system in our community. And I think Trinity and UnityPoint logistically providing those cares, especially on those critical moments, for bringing those informations almost hourly basis coming from CDC and FDA, because we haven't had too much knowledge about this COVID vaccine. It was completely new virus. And then we realized how important is logistically we providing those diagnostic tests and those monoclonal antibody and those vaccination. So I think the whole community realized that we need a strong local healthcare system.
Yeah.
The second thing we learned in this COVID pandemic, that the whole medical model is changing. Instead competition, I think we have to come up with different model as a collaborative system. And every piece, any kind of system that we have in Muscatine, from Mercy, from Genesis, from University, they realized that UnityPoint and Trinity is the only exclusive single solid program localized in Muscatine, and they have to have those collaborative system and basically helping us to provide this healthcare system in Muscatine to be strong. I believe the whole community also realized, and I saw those higher level of administration, they were working harder, more in collaborative way, even with the resources in community, and I heard they had lots of dollar-wise investment in Muscatine to bring more subspecialists and even providing more dollar money to enhance, for example, the OBGYN coming back to town. And we are optimizing our PEDS system here, and they had a lot of good investment for renovation of the clinic. I think there is a lot of good news the community is going to hear soon.
That's awesome. I know, I mean, Trinity Muscatine has been the largest, obviously, healthcare system here in Muscatine for so long.
That's the only hospital.
Yeah, and it's the only hospital we have. So seeing them make investments back into the community and back into the hospital is so important, and it's good to see them making those investments, because it makes us believe that they are they're staying, that they're that they plan on continuing to be our healthcare system, and so.
Yeah,
it's
here
easier
in this camera, I promise I'm 53 years old. I'm planning to retire at 70, so I'm here for 17 years. 17
years. You heard it here. We're recording, right? We're recording, right, Jess? Yep, she's got it. She's recording, so. And I think Rachel's over there. She's taking notes too, so. So one last question. So what do you hope that people will understand about Trinity Muscatine's involvement in our community?
That's a very good question. I think Trinity trying to bring whatever is necessary for optimizing health and well-being of the Muscatine's residents here in town.
Yeah.
And minimizing or even eliminating any discomfort or difficulties for people, especially older folks, to go out of town to see subspecialists. I think days and nights they're working hard to bring in whatever we need here. But I wanted to go beyond that. They were saying, hey, primary care and healthcare system is the first line of well-being. I wanted to say patient himself or herself is the first line of defense.
Yeah.
I just wanted to say, beside primary providers, beside subspecialists, beside hospital and healthcare system, patients needs to know they have power. They have to have that hope, and they have to realize that beside the doctors, they have some power and they have some homeworks to do.
Yeah.
And I think with the COVID situation, we have to realize we have to optimizing and activating all of the resources in the community, not only healthcare system. If we want to optimize the well-being of the community and health of the whole community, all of the community leaders, from religious leaders, from public leaders, from journalists, reporters, newspapers, and in a very collaborative fashion, they have to come together and tell people, hey, go to basic. If they have to clean their air, clean their water, and have a good sleep, and try to eat well, and have a nice regular structural exercises, and try to learn every day something new to optimizing their memory. And especially after COVID, we realize how much social engagement and social connection is important for well-being, we have to help each other, and telling people, hey, we have to get together with respect into social distancing, respect into all of those cautionary measures. We have to get together and help each other, help doctors and help subspecialists to optimizing humans' health, and one by one taking disease and disease out and bring ease and harmony and growing and vibration to the whole community.
Yeah.
And I'm really hoping for that.
Yeah. Yeah. I am a huge fan of Trinity Muscatine, and working there for years, seeing it as the inside and outside. It's a strong system, and there's so many people within that system who really care about the patients and the community, and I love that we have a hospital like that in our community, and I hope to continue to see it grow and continue to see great providers like you coming back, or new providers starting their practices at UnityPoint Health Trinity Muscatine. It's great to see the growth, and to know that, you know, we're gonna have that here in town and not have to go elsewhere for our healthcare.
I'm part of this system, and I worked with this system before. It's a great system. It's very basically they're trying to minimizing the gap between research and clinic, and they're expanding not only in the state of Iowa, they are basically expanding other states, and because structurally they have very good fundamental understanding of patients' needs, and they're spreading very fast.
Yeah. Well, I'm glad that you joined us this morning, and I'm so glad that you're back in Muscatine.
Thank you for having me.
Yes, of course. You can come back anytime.
Thank you.
We are going to go to a quick break, and we'll make sure that you have the information, those phone numbers in the comments section, so that it's easy for you guys, if you need a primary care provider, that you can have that information at your fingertips, and be able to get connected with UnityPoint Health Trinity Muscatine, to get connected with that provider. Whether it be in internal medicine or whether it be in another specialty, we'll make sure that you have those numbers so that you can call and get in contact with them today, and get those primary care doctors if you don't already have one, or if yours is retiring, start the process of finding a new one so you can continue that care as well.
Definitely.
So we are going to go to a quick break to show you one of our great sponsors, and then we'll be back to talk about more stuff happening in Muscatine.
We just don't work out in a single plane of motion.
Hello, I'm Tennille with R7 Reclaimed, located in Grandview, Iowa. We mix old and new goods together so that you can find the story of your home. When you get here, you will find a mix of old and new goods that are put together so seamlessly you won't even be able to tell which is which. And not only that, it's going to speak to you and your home. We are worth the road trip. We call it the R7 Road Trip. So punch in 337 Cemetery Lane, Grandview, Iowa into that GPS and make the road trip.
so much good information about Trinity Muscatine, and it's great to see growth happening there and great providers like Dr. Sagha coming back to our community, calling it his second home, and you heard it here. He's here for at least 17 years when he retires, so that's good news for us. I wanted to remind you all that today, June 1st, is the kickoff of Get Your Rear in Gear. So you heard me go on and on and on about the importance of the event and how important it is not only to me personally but to our community, and I hope that you guys will all you can still sign up. So today is the day you can get on and sign up. I know that Ange said that she has some shirts and stuff available, so you can reach out to her at the hospital if you want to get signed up. You can also go online to Get Your Rear in Gear, find Muscatine, and get signed up that way. You can also email her if you want, angela.copy@unitypointhealth.org. Make sure you get the .org part. And we can put that kind of stuff in the comments section as well for you. But I hope that you guys will sign up. It's a virtual event this year, so you can do it on your own time, walking and just raising awareness for colon cancer, and just get people to get those screenings and all of those important things that we know we all need, but sometimes we need that extra kick in our rear to actually go and get. So today, June 1st, kickoff of Get Your Rear in Gear 2021, and you still have a chance to sign up and get your rear in gear, both virtually walking and raising awareness, but also get scheduled for those colonoscopies and those preventative measures for sure if you haven't already. Our friends at Lutheran Living sponsor National Days, and today there is a whole list of national days. So I picked a few off the list to tell you about. It's National Dare Day, so you can dare some of your friends and family to do things today to celebrate. It's National Pen Pal Day as well, so grab those pens and paper and write a letter to somebody and maybe start a new relationship that way. Wear a dress day. I did not do that today. It's slightly chilly for me to wear a dress. I'm a wuss when it comes to weather. Say something nice day. This is my favorite out of the list. So I encourage you all to go out and say something nice to someone today, whether it's a stranger or someone you know very well. Just give them a compliment, say something nice to them, and make their day better, get their week started off right for National Say Something Nice Day. It's also National Flip a Coin Day, so you can flip a coin to make some of those decisions that you need to maybe you've been putting off. Just flip a coin and get it done. So last reminder, get signed up for Get Your Rear in Gear Muscatine. It's starting today and it goes all month long, the month of June. So it's a virtual event this year, a great event, super cool shirt, and you can be involved in our health of Muscatine and encourage other people to go out and get those screenings. So thank you all so much for joining us today. Thank you to Dr. Sagha for coming on and for coming back to our community and having our healthcare just as a top priority for him. So excited about that. And also one last shout out, happy birthday to my sister Diana today. It's her birthday, so a special shout out to her. And until I see you tomorrow for Wellness Wednesday, Scott's going to be joining us. He'll probably make me do some exercising and put me through a little bit of pain tomorrow on the show, and we can teach you guys all some things that you could do at home, or you could come join us at Impact Athletic Performance and join in the fun. But until then, remember that kindness is free, so spread that stuff wherever you go.
Here at Total Muscatine, we believe it's important to be strong supporters of our local community.
And that's why we donate thousands upon thousands of dollars to local Muscatine charities each year.
It's the reason why all of our employees are local to the area and have a vested interest in our community. Even Daisy and Dilly keep it local by visiting the local dog park.
So remember, when you shop Toyota Muscatine, you're not only sure to get great service, but you're here also supporting local.